A recent Harris Poll survey found that nearly 75% of Texans are worried that the worker shortage in healthcare could have an impact on their own health. So joining me to discuss is the Director at Large of the American Academy of Physician Associates Board of Directors, Eric Martinez. Good morning.
Good morning.
So how is the worker shortage in healthcare impacting Texans? Can you speak specifically to that?
Sure, it's definitely having an impact. If I can share a personal story with you, I have to get annual eye exams, and I know my last appointment took me almost 6 months to get. So I know that our patients are feeling just as frustrated as I am. And in fact, according to the recent poll, 3/4 of the patients surveyed said that the healthcare system just really isn't meeting their needs.
Can you tell me some of the additional findings from the recent Harris poll? Like what specifically were they saying?
So there are two really big obstacles that patients encounter when they try to access care. And one is the long wait times, and the other is financial strain. About a third of patients surveyed in Texas say that they've been financially strained by recent healthcare costs, and that's almost 10% higher than the national average. 50% of Texans also say they've either delayed or skipped care in the past 2 years. And I work in the ER, and unfortunately, that's when I see a lot of patients come in for really illnesses that really could have been prevented if they had better access to primary care.
Yeah, gotten care earlier on in their diagnosis. So you're saying, though, that you think that physician assistants can help alleviate some of these issues. Are you talking about specifically in rural areas where people have less access to care? Or are you talking about just across the board?
Really just across the board, and Texas is a big state, so definitely the rural areas come into play. But there are the PA profession is one of the fastest growing healthcare professions in the country. There's about 168,000 PAs practicing in the U.S. and about 11,000 here in Texas. And the data really overwhelmingly shows that when patients have access to PAs, they have better access. They have better access and they have better outcomes.
Yeah. Talking about doing it across the board, I'm sure you're getting pushback. There's lots of controversy that can come from that. What are some of the obstacles that you're facing to make more PAs accessible to everybody?
PA practice laws varies from state to state, and unfortunately, a lot of these laws are just really outdated and don't really reflect how care is delivered today. Again, as I mentioned, I work in the ER, so there are certain medications that if you came to the ER when you're under my care that I can order for you. But as soon as you go home, I can't write a prescription for that. And a lot of times patients will come back because of that. I recently had an opportunity to go to DC and advocate for some things nationally. And one thing PAs are trying to get added onto is federal workman's comp insurance. So if you're a federal employee, say you're a postal worker or a border patrol agent, if you got injured at home, you could come to a PA and I could treat you. But as soon as that becomes an on-the-job injury, you couldn't see a PA because we're not covered by federal insurance.
Yeah, so you need things to change at the legislative level.
Yes, we do.
Interesting. All right, Eric Martinez with the Academy of Physician Associates. Thanks so much for getting up this morning and making those points for PAs. Appreciate it.